Serving all of San Diego, this is your Fox 5 News.
Well, it is time now for some good old-fashioned grown-up talk. It's a good time to go ahead and give your kids a break from the TV. Maybe put them in the other room, give them a coloring book or something like that. Dr. Irwin Goldstein, the director of sexual medicine at Alvarado Hospital, and Debbie Cohen, a physical therapist at San Diego Pelvic Rehab, are here with exercises that can help you improve your sexual health. Okay, let's first of all talk about this pelvic floor exercise, what it is and what the deal is with it. Dr. Goldstein, we'll have you start.
So basically, female sexual dysfunction is very common. It's 40% of women have this. 10 million women are bothered by this. We've been talking over the years that we've been here on drugs and sexual therapy with Dr. Hartzell, but we now realize, I don't know if you can see this, but this whole bottom part of the pelvis is surrounded by muscles. And those muscles can be either too loose or too weak or too strong and too tight. And they can influence sexual function. So what we've learned is that engaging a physical therapist in this village plan to take care of men and women with sexual problems. So we have a sex therapist, a physician, and we have a physical therapist is really the ideal way to do all this.
So are pelvic floor exercises basically Kegels? Are they the same thing?
Yes, basically a pelvic floor contraction is called a Kegel, but the problem is that many women who have been told to do this aren't doing them right, or they may not really be the ones who should be doing it because some of their problems may have to do with too much tension in these muscles.
So how do you know if you're one of the ones that shouldn't be doing it?
Well, that's where it takes a proper assessment, diagnosis, evaluation by a specially trained physical therapist who's trained to see what's going on in these muscles and help a woman do the proper thing and do any hands-on therapy that's needed as well.
Okay, so can we discuss carefully, because we're a morning show, how to properly do it so people at home can know they're doing this correctly?
Okay, so a proper pelvic floor muscle exercise includes contracting and relaxing the pelvic floor muscles. What that feels like is if, for example, if you're in the middle of urinating, if you would stop your urine in the middle, that's a contraction of the pelvic floor muscles.